For the assessment, we're going to determine the condition of the patient's skin and the extent of soiling of the perineal care. Identify patients, also the capability to participate in the said assessment. So for the analysis, we're going to critically think our data and evaluate each aspects in its relationship to other data. And we need also to identify any specific problems in mobility that may require assistance with elimination needs. And for the equipment and personnel that may be needed, we're going to check that in analysis. So for the planning, we need to determine individualized patient outcomes criteria in using the bedpan, and then we're going to plan and select the appropriate equipment use needed to perform perineal care, and we're going to decide if you need additional personnel assist. So in implementation, we're going to start in washing or disinfecting our hands. So first, I already wash my hand, disinfect my hands before entering in this room. So we're going to introduce ourselves to our patient. So good morning, ma'am. By the way, I'm now Marlene Hope Larego, your student nurse for today. So ma'am, kindly state your name for me. So sasabihin niya yung name niya sa akin for identifying two identifiers. Okay, so we're going to explain also the procedure. So ma'am, I'm going to help you in cleaning your genital area. Is that okay with you? Okay, so nag-agree yung patient natin. So we're going to proceed in pulling the curtain. So next procedure, we're going to pull the curtains, close the door for the privacy of our patient. So I already done that. I already closed the door and closed the window. Okay, so we're going to raise the bed according to our height position, so working position. So I already raised the bed. I put a pillow here para makita na naka-raise yung patient natin. And then, dahil hindi naman to hospital, so this is only an improvised working area. Let's proceed. We're going to wear our gloves. So, ito yung gloves natin. I'm going to wear it. So, let's proceed in our assessment. So, for the postpartum or surgical patient, if the patient is able to go to the bathroom, then let our patient sit on a toilet and pour warm water over perineum into toilet. And however, if patient is unable to ambulate to the bathroom, kagaya ng patient natin ngayon, we're going to assess her or help her in placing a bedpan according to assessing with a bedpan. So, we're going to remove first the dressing or pads. So, ma'am, pwede ko bang remove yung pads nyo or dressing? So, nag-agree yung patient natin. So, alisin muna natin yung garments. So, for instance, ito yung pads or dressing. So, we're going to put it in a basket here, separate place, disposal. Okay, so next, we're going to place the bedpan, position the bedpan according to the procedure. So, for instance, ito yung bedpan natin. So, we're going to place it here, here. Ganyan. And then, so, ito yung genital area ng patient natin. Improvise only po. Okay, so, we're going to pour pure untapped tap water or solution in facilitating over the perineum. So, let's ask first the patient, ma'am, pwede mo bang feel yung water kapag tama lang ba siya or mainit ba? So, ask natin yung patient, and then kapag nag-agree naman yung patient natin, we are going to proceed the next procedure. So, we're going to pour tap water here in in her genital area. Small amount lang. And then, after that, we're going to, uh, dahil na-rinse na natin ng water, we're already rinse water yung genital area ng patient natin. We're going to use cotton or any white cotton or in a towel. And we're going to wipe it anterior and then posterior. Dito muna and then patas. Okay? And then we're going to use a cotton balls, gauze, or wipes or any that we can use in wiping the genital area of our patient. So we're going to start from the front and then until front to back. Okay? Then hindi lang iisa yung gagamitin natin. Pagkatapos nito, we're going to place it in a hindi natin ilalagay dito sa bedpan, ha? Ilalagay natin dito sa trash can. Okay? So, kuha ulit tayo ng clean wipes para sa posterior naman ng patient natin. Okay? So, we're gently yung pag-wipe natin, huwag yung pa-rough. Okay? Kasi masasaktan yung patient natin. Then, replace any dressings or pad. So, i-remove muna natin to. Pagkatapos, excuse me ma'am. Excuse me ma'am. Okay. Then, replace natin yung kanina. So, replace natin. So, ayan. Then, make her patient. So, for non-surgical patient naman, after placing a waterproof pad under the patient, we're going to wash the perineum with warm water and mild soap. Okay? And so, we're going to use a washcloth. So, we're going to do the proper way doing it. Okay, so ito na yung washcloth natin. Kukuha tayo ng bath soap, ang ganyan. Pero mild lang, hindi siya masyadong mabula. And then, in a warm water. So, pagkatapos malagayan, itatap natin dito. So, we're proceeding. We're going to gently separate the labia of the female patient. So, ito yung genital area ng patient. So, we're going to separate it. Pag ganun. Separate natin. And then, clean from front to back one side. So, one stroke siya using the other. So, ganyan. And then, downward motion. Change areas of washcloth use. So, sa side naman. And then, use and repeat cleansing stroke on the other side. Ganyan. So, per sides, kapag nagamit na yung side, gamitin sa ibang side naman, gamitin natin yung clean side. Tapos, pagkatapos nun, we're going to rinse this. So, we're going to rinse it. Okay? So, pagkatapos na ma-rinse, ganyan, we're going to use it and repeat the procedure in cleaning the genital area of our patient. So, gawin din ulit natin yun. Repeat as needed. And i-repeat natin then other stroke ulit sa side niya. Okay? For the male patient, we're going to get a towel ulit. Okay? So, for the male patient, clean beginning with penile head. So, ito yung penile head natin. And move downward along the shaft. And retract the foreskin of uncircumcised male gently. So, ito yung penis ng patient. And then, we're going to retract the foreskin kapag hindi circumcised yung patient. So, for instance, circumcised yung patient, so no problem. Okay, slowly. Cleanse. So, side din yung gagawin natin. Tapos, wash ulit natin, then repeat the process. Okay? So, katapos nun, we're going to tap it to dry the scrotum. Okay? Then place it here. Okay? So, we're going to let the patient move away to us to clean the anal area of our patient. So, ma'am, pwede ka bang magpa-side? Pwede ka bang tumingin sa kabila? Okay? And then, I'm going to... Okay, so, nagpa-side na yung patient natin. We're going to get a clean washcloth that we can use in cleaning the anal area of our patient. Then, we're going to... And then, nilagyan natin siya ng soap and then rinse it with the warm water. Ganyan. And then, we're going to wipe it here on the anal of our patient. And then, rinse the area and dry it with. Okay? So, ito yung dry na cloth. We're going to make it dry yung ano. Kasi pagkatapos natin siyang i-wipe, we need to wipe ulit ng dry cloth. Going further, for the patients with catheter, we're going to wash the perineal area thoroughly with soap and warm water. So, ito yung catheter. We're going to remove it. We're going to wash the perineal area. Going to get a warm, clean cloth. Then we're going to use a soap and then a warm water. Kapag nabasa na siya, lagyan natin siya ng soap, mild soap. Then we're going to wipe, especially doon sa part kung saan nakatusok yung catheter natin. So, clean well around the entire insertion site, then rinse it with a warm water. Then, get a clean cloth, then tap it to rinse it dry. Then, after that, we're going to remove the bedpan and discard the content. Excuse me, ma'am. Okay. And then, we're going to discard the contents and then replace the bed lines. Excuse me, ma'am. So, we already replaced the bed line. So, going to make the patient clothe herself, replace the bed lines, and then reposition the patient. So, naka-reposition na yung patient natin. And we're going to lower the bed. And then, we're going to cover our patient to make her comfortable. And for the equipments, we're going to care for equipment appropriately and we're going to remove our gloves. And we're going to, after this, we're going to disinfect our hands. So, for the documentation, for the perineal care, we're going to document it on a flow sheet or any record it in a narrative notes, any pertinent observations, such as reservoir readiness kapag may tenderness ba sa area or unusual drainage, or any difficulties in carrying out the procedure should be noted in the nursing care plan.